So we have Dr. Emily Arnold, who's professor at CAPS in the Division of Prevention Science, and her research is primarily devoted to promoting health equity for ethnic and sexual minority communities, with an emphasis on collaborative research designs and developing and testing intervention programs. As an anthropologist with training in public health, Dr. Arnold has a great deal of experience in conducting and teaching others to do qualitative and mixed methods research, and has worked with various research teams as well as early career investigators, postdocs, international trainees, graduate students, medical students, and community members. So really training the future. She co-directs the NIMH Visiting Professors Program and the newly funded UGMA Mentoring Program. So she also leads the Northern California HIV Research Policy Center based here at UCSF. And I'm trying to make sure, and has a number of ongoing HIV-related studies currently. She'll be sharing some of that with us, and has been working in COVID vaccine uptake science as well. And partnering with Emily during this talk is Dr. Lucia Abascal, as a physician and second-year global health Ph.D. student at UCSF. She completed her medical training in Mexico City, where she's from, and a master's degree and global health fellowship at the Institute for Global Health Sciences, IGHS, here at UCSF. In the past year, Lucia has worked with the San Francisco Department of Public Health Contact Tracing Project, and has had multiple roles as a subject expert giving talks to different audiences. She's currently doing research on public health COVID-19 preventive measures for Spanish speakers in San Francisco, and has participated in other COVID-related projects in Mexico and California. And she also leads the Acceso COVID, I'll say that right, a website that summarizes and translates up-to-date COVID research to Spanish to increase information dissemination in Latin America and other Spanish-speaking regions. And most importantly, Lucia loves tacos. Okay, so now I'm hungry, but we will let Lucia and Emily nourish our intellects and with their science instead of providing us tacos, which would be great. Okay, take it away, Emily and Lucia.
Thank you so much, Mallory. That was a great introduction. It's so nice to see you all on Zoom. I'm slightly missing the days of town halls when we would meet in person and actually eat lunch together, which makes me think that perhaps at some point in the future, we'll come back with an update and we'll bring tacos for that one. So Lucia and I are here today to speak with you all a little bit about a project that is funded by the CDC through our Prevention Research Center. So this is a supplement to the PRC parent grant, which was awarded about a year ago. And our work has been focusing on encouraging COVID vaccine uptake among Black and Latinx communities here in the Bay Area. I definitely want to acknowledge the amazing contributions of our wonderful team, including Lucia, who's been able to join me here today, as well as Andre Moriana, Chad Campbell, Gustavo Sajase, Barbara Green-Ajusbo, Beth Bordeaux, John Hamiga, and Margaret Handley. Several of you are on the call today, and it's just wonderful to be able to represent this work. So just to give a little bit of context, some of you may be aware that vaccine uptake has remained lower within certain African-American and Black and Latinx communities, particularly in Alameda and San Francisco counties. Looking at data with young people, we see disparities that track across the younger age groups, from pediatric vaccine uptake among ages 5 to 11, our more adolescent age groups from 12 to 17, and then looking at younger adults, ages 18 to 29, we see lower uptake across the region within these particular racial and ethnic minority communities. And these are also the same communities that have suffered disproportionate COVID-related sickness and death over the course of the pandemic. A host of factors relate to the decisions to wait or forgo COVID vaccinations, which range from logistical or structural challenges to vaccine misinformation, as well as, frankly, well-placed mistrust or distrust of public health institutions and the medical establishment. We've been working very closely with community and public health partners who have been focused on creating access to vaccines in equitable and appropriate ways. So this is a two-phase study design. We conducted a series of observations as well as key informant interviews and focus groups during fall of 2021. Basically, we were funded in late May of 2021, right around the time that COVID vaccines were becoming available. And it was very apparent at the CDC that COVID vaccine uptake was going to need some additional support and research to make sure that it was equitably accessed across the US. And the PRC at UCSF is actually part of a much larger network of prevention research centers. There are 26 such centers across the nation. And what the CDC did is offered the supplementary funding to all 26 centers, asking research personnel to partner with public health departments. So this was a requirement of the funding announcement, as well as community-based organizations. So we are working very closely with Alameda as well as San Francisco public health departments, and then we have identified over the course of the research community-based organizations to also partner with, and I'll say more about that as we get closer into the details of the work. We used template analysis. So we followed Allison Hamilton's approach to rapid qualitative data collection and template analysis to really try to identify best strategies that could improve trust as well as vaccine uptake within these particular communities in San Francisco and Alameda County. On the basis of the formative research, we decided that it would be most appropriate and efficient for us to focus on two particular communities in each county. So we decided that we would work with Latinx communities, and in particular ESL, so English as a second language learners, partnering with Mujeres Unidas in Alameda County. And Lucia is going to share some of the more details about that work. And we're going to be working very closely with YMCA Urban to connect with African-American and Black communities, in particular young men, to increase vaccine uptake and field a range of different interventions to promote vaccine uptake and trust in communities in San Francisco. So as I mentioned, we received our IRB approval in late August and went immediately into the field. We collected 2 focus groups and 2 in-depth interviews with unvaccinated as well as vaccinated youth, both in San Francisco as well as Alameda County. We also were really interested in perspectives from parents because it was very clear that we were going to be seeing vaccines very likely be approved for emergency use authorization during the time that we were in the field. And there was a lot of concern about how parents in particular of younger children might respond and whether or not they would be willing or not willing to get their children vaccinated. So we really made that a particular focus of the formative work that we completed last fall. In addition to working with community members and trying to elicit insights from people themselves, we also did several key informant interviews covering perspectives from public health department personnel, community-based organizations, vaccine pop-up agencies and clinics, as well as clinicians and medical providers who are actually working in communities. We did 16 of these in Alameda and 7 in San Francisco. And then we did a series of report backs to public health departments and our community-based colleagues to really brainstorm what the best steps might be. We have a manuscript in process that is being led by Dr. Campbell. So just to very briefly share some of our suggested routes for intervention strategies on the basis of our key informant interviews One of the things that seemed to really become clear is that a number of people were going online for information about vaccines. And it was going to be really important for us to have an online presence and to also promote existing online content. So using social media to market particular kinds of messaging. So messaging that was provided by people who look like they're from the communities, who may actually be from these communities themselves, or just appear to be from urban communities, who are people of color, frankly. So we were also told that it was really important to consider peer-based interventions and to frame COVID vaccine uptake, COVID-related health promotion within an ongoing and more holistic health education kind of a program. We also heard very importantly that it was going to be crucial for us to avoid scientific language and jargon, that we needed to really break things down into simple, more relatable ways, and to use often sort of relationships as a way to promote people's uptake of vaccines. So as I mentioned, we identified 2 partners to help us deliver community-driven interventions. And we've really allowed our community-based partners to determine what shape those interventions actually look like. So with the YMCA urban team, we're going to be working primarily within, actually it's a violence prevention program that works with young men in communities, and creates sort of healthy norms within peers, helps to develop professional development. And then what we're doing is integrating COVID vaccine uptake and COVID healthy choices into this larger curriculum. And using peers who are involved with that program to also help train them to have conversations with other young people to promote COVID vaccine uptake in their own communities. As you'll see, we really have understood from our community partners that COVID is not necessarily the highest priority right at the moment. And so we've really needed to try to find creative ways to integrate COVID into existing social, educational, or health-related programming that's been ongoing. As part of some of that work, we're empowering lay people to also recognize mis and disinformation, to challenge it in their networks. As I mentioned, we have an online presence. We have established a website, but we also are doing a great deal of work on social media and messaging to correct misinformation about vaccines. We recognize that relationships and repeated conversations are necessary, and this is a process for many. I'm going to let Lucia now talk a little bit about some of the work that we're doing, particularly around myth busting.
Yeah, so as Emily mentioned, like 2 things that came up a lot, and I think we've been hearing also from our partners in other prevention centers across the country, is that one, people have competing health interests, right? So we've talked about COVID a lot. COVID has had the spotlight for a while, and now there's other things to take care of as well. No, it could be street violence, but also like diabetes, hypertension, whatever. And the other one is also like community-based organizations also want to continue doing what their original mission is, right? Going back and changing all their schedule, all their programming about COVID is not something like that's sustainable. So that's how we actually, the work we're doing. I'm going to talk specifically about the example with Mujeres Unidas. Mujeres Unidas y Activas is a women's group, immigrant women's group, Spanish speakers mainly, but they also have indigenous communities from Latin America. For example, they have a very big MAM, which are Guatemalan indigenous women. So it's mainly women, and their main focus is immigration rights, work rights, and work around that. With COVID, they did shift to include more COVID programming, but as time passed, they kind of got tired of it. So working with them, we're trying to integrate COVID into their existing activities, not to create like a new space for that. So part of that has been just being present to answer questions. I've given some talks to them about vaccines, but also about other public health and health topics. And also one of the most interesting, I think, and fun things we've started to work in is part of their general CBO activities is ESL classroom. So English as a second language, they provide this to the women that they work with for them to learn English. So using that model that they already have, they have students, we are trying to build a COVID into it, but speaking of wider health issues, right? So for example, we've talked about the right to health, and then we mentioned the right to COVID treatment, but also like maybe talk about in general, like prevention of breast cancer or other diseases, and then talk about COVID as part of an integral holistic view of health and not just as COVID as a silo. And then recently we've started, and this was actually, we had like a workshop with the ESL classroom where we were working on how to identify fake information. We used COVID as an example, but it was not only about COVID, right? It was how to identify fake jobs, how to identify political misinformation. And it was actually fun because we got with a classroom, we got to apply this to the website we were developing at that time with our group. So we got like, do you trust, like we got the people's opinion about how trustworthy our website and our content was, which was really good. And right now we are moving to formalize that as more of like a research. So there's a lot of work out there about how to identify fake information, but it's all targeting high literacy groups and English speaking groups. So it's like, take these 10 steps and you'll know if that's fake information, but it's hard. So what I'm trying to do, and we're gonna try to do, is actually do some focus group to develop tools so that low literacy groups can identify fake informations. And I mean, our focus is to identify fake COVID-19 information, but the idea is to create a tool that can translate to other online information. So that's what the next steps we're taking. And yeah, we hope to create something that's very useful for them. And we're also with the YMCA group that we're just finalizing our contract with them, but we're going to target that more to youth-driven activities related to the vaccine uptake.
Thank you so much, Lucia. So there's a lot of different pieces at play. We're going to be tailoring, obviously, these intervention strategies to the communities that we're working with and engaging with. We'll be evaluating those strategies in the coming months after they are being fielded. And we will look forward to coming back and reporting out on some of our findings. Definitely want to acknowledge the wonderful contributions of the entire team. And please make sure to check out our website. We have a QR code there, as well as a link to the website itself. All right. We're happy to answer questions and look forward to hearing other people's thoughts or opinions about the work we're doing or the amazing work that Sophia is about to embark on herself.
Great. Why don't we open it up for questions for all three speakers for all three projects? I'll jump in. I'll get things going. So this is for any of the three of you that wish to answer it, or all of you. Now that you're starting the work, what is the biggest challenge you think in front of you with what you've got in front of you? What do you wake up at night and go, oh no? What do you think is going to be a hurdle you've got to figure out how to get over?
I can answer that from more of the activity intervention side of the work we're doing. It's just the changing nature of COVID and how that has. We started this I think the data collection last summer. So in that time, vaccines have been approved for teenagers, vaccines have been approved for children, boosters have been approved, second boosters have been approved. So trying to keep up with that and trying to keep up with people's opinions on that has been, I think, hard, a hard thing for us.
I think the other thing to just also add to that too is how politicized COVID vaccines have become. And so it's really been very interesting for us working here in the Bay Area, where there's, I would say in general, broad support for vaccinations, at least on the surface. Sometimes we have had to work really hard to recruit people who are chosen not to be vaccinated, to make sure that we are really including those perspectives in the work that we're doing. And so there definitely has been some challenges around trying to do that online and do remote data collection and remote level recruitment to try to bring out those perspectives and make sure we're including them.
That's great. Yeah, I would say, I mean, for me and for these two projects, that really for the one that involves the messaging and developing of Spanish language messages, the impact there with COVID again would be that the focus groups, particularly for this kind of thing, I mean, there's just so much that can't translate to virtual work. So I am really looking forward to doing focus groups in person and hoping that can still happen, because it's just such a great way to be able to like brainstorm things, literally collage images, work with different mediums to really co-develop those things together. So I'm hoping that we can continue to work in person. And I would just also say, frankly, and perhaps this is a little too personal, but always timelines, like keeping strong timelines with this is one of the things that really gets me when new projects come in. There was like, of course, the nice clean timeline that was included for both or for any of these in the proposal itself, but just ensuring to make sure that those are realistic and to keep abreast of that. Particularly both of the ones that I presented are short 1-year timelines. So getting all of that done within a short period of time is one thing that keeps me up at night. No, but I mean, just really keeping track of that is important. So I would say that. And I also had a question, but I don't want to jump in too much if other people do, but I'd love to hear around that, the strategies that you were talking about, Lucia, around helping people to discern between like kind of the quality and the validity of information sources. That just seems like it is so critical for COVID, and even beyond, it's just such an amazing health literacy skill. And I was wondering if you all could say a little bit more about that.
Yeah, definitely. So I think we also thought it was like something that could include COVID, but was not COVID central. So it's like a hard skill you can, I guess, teach people, and there's not much out there. So if you Google like how to identify misinformation, there are pretty standard like checklists, but those are very high. It's like compare the URL and see if it ends in co or com, like things that are just like people are not going to do. Yeah. So I think first that's when the idea came to be like, maybe we should develop a tool that people with low literacy or maybe that are not primary English speakers can use. But we wanted to first understand how people actually trust information, no? Especially information that comes through social media. So we just developed the focus guide group, and it still focuses on the main aspects of information. So for example, source, messenger, channel, no, like different things that come into play when we receive information. And we want to understand how people judge and, like, I guess, assign points of value to that to generate an idea if they should trust or not trust that. I don't know if that makes sense, but with the goal of like maybe creating a tool that summarizes all of this together. So we have like a checklist of these are the things, and maybe develop, I don't know, an infographic or something that people can look at and understand, like, oh, these are the things I should look at when I have, when somebody shares a piece of information in WhatsApp or in Facebook. And this is like, just like the basic things I should make sure the piece of information, be it a video, be it a text, be it whatever, has, for me to at least like say, oh, this is like trustworthy or not. I mean, there's not a lot of research. There's some research done on the political like on the political side of this, of how people trust political information, but not a lot on the health side. So I think we're gonna pilot to see if we find something cool.
Thank you so much for that question.
So we have 2 minutes before the hour. If someone has a quick question, and by which I mean hopefully has a quick answer, go for it. If not, but yep, I'll give people a moment to chime in. Don't see anyone jumping in. In that case, I want to again thank and congratulate our 3 speakers for their for sharing the work that they've started. And as you all, I think, promised, or at least as I heard, you all offered to come back and tell us what you find once you've done the work and done the analyses and figured out what they meant. We'll help you figure it out too. So we love that part of it too. So again, thank you, congratulations, and yeah, best of luck with the work. It's exciting and important and all very timely. So thank you very much.